Of course, but what is not always fun is lower back pain. And it seems like everyone at some point in their life has suffered through lower back pain, but we often don't understand the exact source of the pain and don't seek treatment when we should. Dr. David Hicks, as Central State's orthopedic specialist, recently shared some helpful information with Keith. Let's take a listen.
Okay, Dr. Hicks, first off, thanks for joining us. Ask you about lower back pain. That's something that it seems like a lot of people suffer from, and it just drives them crazy.
It's really common. Most people suffer from some low back pain in their life. Unfortunately, there's a few people that have a lot of back problems.
All right, now you've got a spine here. Generally, though, when we talk lower back pain, how far down are we talking, and is there a particular area that's more susceptible to that pain?
Well, typically, when we talk about your low back, we're talking about one of the bottom 5 vertebrae of your low back. This would be a skeleton. This would be from the front, so this would be your pelvis, your sacrum, or your tailbone. Then you have 5 vertebrae in your low back. They're numbered from the bottom to the top, so it's 5, 4, 3, 2, 1. We number the bones, but actually it's the discs that lie between the bones that are the source of most back problems. Your discs are a structure. They're a soft tissue pad that have 2 parts. The outer part of the disc is a series of interwoven ligaments, and the job of those ligaments is to control the movement of the spine, to allow some movement, but prevent excessive movement. The center part of the disc is a gelatinous core that acts like a shock absorber, and everybody's heard of a herniated or ruptured disc. That means that a fragment or a piece of that central gelatinous core, which is kind of like lobster meat or fish meat or crab meat, a piece of that crab meat breaks free and gets squeezed out into the spinal canal. And when that happens, it can irritate a nerve, and you can get what we call a pinched nerve or sciatica. But in reality, the more common problem that people have is that as we age, as we get older, a lot of our body tissues lose water. Your skin, the lens in your eye, and the discs. And as your discs lose water, they're less well able to do their job. And since their job is to control the movement of the spine and act like a shock absorber, as the discs lose water, as they're less well able to do their job appropriately, when you apply loads like sitting, standing, walking, bending, twisting, things that occur in gardening, tennis, golf, the discs don't manage that physical load or stress appropriately, and it becomes inflamed. And then you feel the inflammation in the disc as back pain.
So we come in, we've got the MRI, we've got the X-ray. What is the course of treatment that more than likely someone will receive lower back pain?
Well, typically with someone with low back problems, and there's a difference between low back pain and low back problems, because a herniated disc and a pinched nerve is likely going to be treated differently than someone who has just pain in their low back, which would be low back pain. But basically there are 3 treatment options, and the treatment option that we use most commonly is a program that consists of a program of back and abdominal muscle stretching and strengthening exercises, 2, appropriate use of medications, maybe like Aleve or Advil, and most importantly, a regular program of low impact, low intensity aerobics exercise. So walking, elliptical trainer, treadmill, exercise bike. We know that the one thing that we know is really good for the health of the disc is regular, low impact exercise. And the thing we know that's bad for discs is nicotine. So the 2 things you could say in the long run that are going to permit you to do as good as possible is to try to stay fit and healthy and avoid nicotine.
Dr. Hicks, thank you, sir.
Well, thank you
Appreciate
very
your
much.
time.
Appreciate
I feel better already.
All right, here's some more information for you. Central State's orthopedic specialist, 6585 South Yale Avenue, William Medical Building, 481-CSOS, or that'd be 481-2767, CSOSortho.com for more information.